If you've just been told your breast scan is BI-RADS 4, that's BI-RADS, category 4, I know you're searching for answers right now. Here's what I'm going to explain in the next few minutes. What BI-RADS 4 category actually means, why your doctor is recommending the next step, and exactly what questions to ask, so you feel in control of what happens next. By the end, you'll know exactly what step comes next and why. But first, the most important thing you need to hear, BI-RADS 4 is not a cancer diagnosis. It's a recommendation to confirm what the scan is showing, because imaging alone can't give us complete certainty. That's the core message. That's what this category means. BI-RADS is simply how radiologists communicate what we see and what the safest next step is. When the BI-RADS category is 4, it means I can't safely call this benign based on the scan alone. So let's confirm what it is. Now here's the key difference. That explains why your doctor isn't just suggesting another scan in 6 months. BI-RADS category 3 means this probably looks benign. Let's watch it. BI-RADS category 4 means this needs confirmation. Let's not wait. The most reliable way to confirm is usually a biopsy or another form of tissue sampling recommended by your team. And here's what many patients don't realize. BI-RADS 4 is actually a broad middle range. That's why it's divided into 3 levels. 4A, low suspicion, more likely benign, but needs proof. 4B, moderate suspicion, could go either way. 4C, higher suspicion, the most concerning within category 4. If your report only says BI-RADS 4 without A, B, or C, don't panic. Some facilities don't list the subcategory. You can ask your doctor which level it's closer to. It helps you understand what to expect. Now let's talk about the word that worries most people, biopsy. Many patients hear biopsy and picture an operating room. But most biopsies for this category are outpatient procedures done with numbing medication and imaging guidance, like ultrasound guidance or mammogram guidance. It's usually quick. You'll feel pressure and some pushing. Most people find it uncomfortable, but very manageable. The goal is simple: replace uncertainty with certainty, and very often, that certainty is reassuring. Here's something that might surprise you. Benign conditions can absolutely look suspicious on scans. Common benign causes include fibroadenomas, complex cysts, and fat necrosis, a scar-like change after injury or surgery. This is exactly why this category exists. Imaging can't always tell benign from malignant without tissue confirmation, so doctors err on the side of caution. Also, sometimes a finding gets this rating not because of how it looks, but because it's new, or it has changed since your last scan. Stability over time is reassuring. So when something is new or different, radiologists investigate more carefully. It's part of safe medicine. After your biopsy, doctors do something very important. They compare the biopsy result with what the imaging showed. That's called checking for a radiology pathology match. If the biopsy says benign and the imaging looked mildly suspicious, that's usually a good match. And you can move forward with confidence. But if the biopsy says benign and the imaging looked highly suspicious, that's a mismatch. In that case, your doctor may recommend a repeat biopsy or a surgical consultation. Not to alarm you, but to make absolutely sure nothing was missed. That's standard practice. It's how careful medicine works. So here's what I want you to remember. Category 4 means Let's confirm this. It does not mean you have cancer. And to help you feel more in control, take a moment and screenshot this list. These are the most useful questions for your appointment. Is this 4A, 4B, or 4C? What type of biopsy are you recommending? And where will it be done? Is this something I can feel or only visible on imaging? When will I get results? And if the biopsy is benign, how will you confirm it matches the imaging? One more thing. The unknowing is hard. I understand that. But here's what happens next. You'll get a clear plan, you'll have a procedure that gives you an answer, and in most cases, that answer brings relief. You're not navigating this alone. Being informed is one of the most powerful tools you have. Write down your questions. If you can, bring someone you trust. Extra ears help. And trust that your medical team is working to give you clarity. And if this helped you feel calmer and more in control, I've made more explanations like this. You can find more patient-friendly breakdowns of medical reports at RRJ Health, where we explain things without the panic. See you in the next video. Stay subscribed.